Hello, I'm Dr. Keva Garg. I'm an electrophysiologist at Virginia Heart. This means I'm a cardiologist who specializes in heart rhythm disorders. Nowadays, many of my patients are using wearable devices, like an Apple Watch or a fitness tracker, to help track their sleep or exercise in their daily lives. With advancements continuing to be made in the healthcare technology space, there are many potential health benefits to some of these devices. Many of my patients ask me, what can I do at home to monitor my heart? Today, I'd like to go over some of the common devices that are out there, primarily the Apple Watch and the Cardio device, and ways that you can use them at home to get better data to share with your cardiologist. Whether you already have a diagnosis of an abnormal heart rhythm, or are worried that you might have one, or just generally want to get a better sense of what your natural heartbeat is doing, these tools can be used to start collecting useful data. If you are generally healthy and you're trying to measure your heart's natural speed, the Apple Watch or fitness trackers can measure your heartbeats per minute using a sensor on the back of the device. They'll send you alerts if your heart rate goes outside the normal range, either too high or too low. Using this data, you can discuss with your doctors if this is concerning or not and requires further testing or treatment. If you want to use the Apple Watch or fitness tracker as a screening tool for atrial fibrillation, you can set up irregular heart rhythm notifications. If the watch detects something irregular in your heartbeat, it will save a recording that you can share with your doctor to evaluate if you truly have an abnormal heart rhythm that needs further treatment. If you have already been diagnosed with AFib, you can set up notifications on your Apple Watch to record how much atrial fibrillation you are having and use these to easily record episodes to be shared with your doctor. This can help you get a better sense of how well controlled your atrial fibrillation is and monitor if it is the same, better, or worse over time or in response to some changes or therapy. Lastly, if you are having the sensation of an abnormal heartbeat that you would like to record, you can go to the ECG app on your Apple Watch or fitness tracker and record a 30-second ECG that will transfer to your health app on your phone. While the Apple Watch is a great tool for everything we just discussed, note that it only gives us one electrical tracing of the 12 that we traditionally evaluate on the ECG in the clinic. The Apple Watch does not replace a thorough evaluation with your doctor, but will allow you to contribute additional data to help you feel more in control of your health. The Cardio device is a credit card-sized device that you can put your fingers on and can give your doctor more of those electrical signals that we need to make a formal diagnosis. And this allows for more detailed and accurate interpretations. For people who have longer symptoms that allow you enough time to get your device out to make the recording, this is a great tool to own. Once recorded, the Cardio device makes it easy for you to send those ECGs to your cardiologist. It's important to note that these devices can only provide so much information about your heart. Sometimes they can give false alerts or miss important information that can only be picked up with more advanced equipment at your cardiologist's office. Do not completely rely on these devices for your heart health, and please remember to schedule an appointment with your cardiologist if you're experiencing symptoms.